I'm here with co-founder and medical director of LifeWorks Wellness Centers. Dr. Minkoff, welcome to the show.
Thanks, Shelley.
Such a pleasure to have you here. It's always nice to get informed by you and all your topics, and you guys cover pretty much all of them. So with that being said, and a quick synopsis, tell me about your clinic.
We have a clinic that services people from all over the world. We probably have in one place more different kinds of therapies and diagnostics than any other place that I know of. If I would have a patient that I couldn't find what was wrong with them, I would go searching to find some other diagnostic modality or treatment modality. And so we now have it under one roof here in Clearwater, Florida. And people come in and they're like amazed that, gee whiz, you're doing this part which helps this, and that part which helps that, and that part which helps that, and they're all sort of critical in piecing it together.
Yeah, and thread it all together you do. Now, some of our viewers may think, you know, that guy looks familiar. You are on a Netflix documentary called Root Cause.
Right.
Now, you're not a dentist.
Right.
However, you do put quite a bit of emphasis on the health of your teeth. Tell me about that and why.
Well, for some reason, the dental profession has the idea sometimes that the teeth are not really in the body and that you can do things in the teeth which won't affect the body. And what we found is that if a person doesn't have a healthy mouth, healthy gums and teeth, they're not going to have a healthy body. I've had many, many patients where they came in with fatigue issues or pain or brain fog or Parkinson's or MS or autoimmune disease, rheumatoid arthritis or lupus or things like that, where they've been treated by doctors mostly in a symptomatic way. Like, yes, they have pain and they get something for pain. Or yes, they have tremors and they get something for tremor. Or yes, they're fatigued all the time and they try to give them something to wake them up. What we're trying to do is like, why did that happen? You weren't always like that. What underlies that? And many times we find that it is dental issues. We know that most of, and this is accepted by cardiologists, most of artery disease is related to dental problems. Pockets in teeth, bacteria in teeth can cause artery disease. These bacteria get into the artery wall, they cause inflammation. But we also find that people with dental disease can get poisoning from the amalgams in their teeth or from the infections in their teeth. And if you don't handle that part of it, they just won't get better.
Wow.
So I look very carefully at their teeth. I take a good dental history. We often do a specialized kind of x-ray of the teeth called a cone beam CT, where we can actually look at the teeth and see, is there silent infection? And these silent infections can have a systemic effect on the body. And if we can handle these infections, then the body can get better.
And so this is a therapy that you would do, or something to help you diagnose what is really going on. Say, for example, if an individual came into your clinic with issues of whatever they are,
right,
that's a source that you look at.
Yeah, so I have dentists that I work with, and if I have a suspect, or I suspect that there's some kind of a dental problem, I will send them to the dentist, get a comprehensive examination. Now, most dentists are not thinking of teeth as a source of systemic problems. They just aren't taught that way, and they're not thinking that way. I was at the Canals County Dental Association a couple years ago, gave a lecture to the dentists, and my plea was, listen, we are both taking care of the same patient. What I'm doing as a doctor might be affecting what you're doing as a dentist and vice versa. And that if we can work together in a coordinated way, we can solve this patient.
Sure.
I had somebody a couple years ago who had chronic back pain. She had 2 back operations. She was a fitness instructor before this. She walked into my office with a 4-pronged cane on OxyContin every 12 hours. It turned out the problem with her back was referred pain from an infection in her jawbone. Wow. And when we fixed the infection in her jawbone, I didn't fix it, but the oral surgeon fixed it, her back pain actually went away. So this isn't such a far out thing. We know that there is such a thing called referred pain. And when I spoke to the oral surgeon about, I think that implant has to come out because it's affecting the low back, he said, gee, I've seen referred pain causing headaches and these kinds of things, or neck pain, but not back pain. But when he removed the tooth, within about 2 or 3 months, her back pain actually went away. And she was scheduled to have a back fusion because the 2 prior surgeries hadn't helped.
My goodness, I'm sure she was very grateful to know
She
that
was.
this happened. My gosh.
Yeah.
So with your alternative health clinic, it just goes to show you that you guys really do the full circle, and that our bodies are pretty miraculous in and of themselves. Are there any final thoughts you'd like to leave our viewers with?
I think teeth are really important. I think that people need to take care of them, and that your teeth might be underlying your chronic medical problem, and your dentist may not suspect it. And the traditional ways that teeth are looked at, which is if they look good and the regular 2D x-ray is okay, that you're fine, that you may not be, and you need more precise diagnostics to figure it out.